Hi, I'm Dr. Michael House here in Sarasota, Florida at All Natural Healing Medical Center. And today we're going to talk about an alternative to surgery for your shoulder or shoulder replacement. I always tell all my patients you should try the all natural ways first. And that's all we do here is all natural medicine. I've been doing this for shoulders for over 20 years. I've helped many people who had shoulder injuries. I've actually helped people after they got shoulder surgery, it didn't work. I had one guy who got 3 shoulder surgeries on one shoulder and one on the other, and none of them worked. So you really want to use your alternative ways first. And so let me explain a little bit about, it's called a rotator cuff injury. All right, you have your muscles, and then they come to tendons, and then they hook around this part of your shoulder. There's 4 muscles in the rotator cuff. There's the subscapularis, which is in front of your chest. There's the supraspinatus, which is on the top of your shoulder that lifts your arm. And then there's the infraspinatus on the back. And then there's a small one called a teres minor. And the teres minor is always the one when you sleep wrong, you feel like you're going to have a knot in your back and you feel like it's going to be a heart attack. That's about the only injury the teres minor has, and it's because it's really small. Now, when you tear a muscle, it typically retracts. That means it goes like this. But the shoulders, all they do is they come up like this. And so when they do shoulder surgery, they'll go in orthoscopically, they'll trim that extra stuff, then they'll either use stitches or staples or Band-Aids, and then what happens is it's kind of like if you put stitches or staples in a shirt and you pulled that shirt, it just tears. Because you've got to understand, this shoulder surgery is the hardest thing to heal. In general, just the shoulder is hard to heal. It typically takes up to 2 years, and the reason why is your shoulder is always hanging, so it's always pulling. So that's why it's not good to get those stitches or those staples, because it's pulling, okay? And then they make you get shoulder replacement surgery. And I always talk to my patients and I say, there's all these commercials on TV with these lawyers suing joint replacement companies, and they wouldn't be suing them if they were working. So that's the last thing you want to do. And see, here we use a protocol. It's called Prolopuncture. Prolo means proliferation of cells, and puncture means in the acupuncture points. We're literally sticking the shots in the acupuncture points, and they're exactly where the tears are. So if you tear your subscapularis, it's going to be on the front of your shoulder. The supraspinatus will be the top, and this infraspinatus will be the back. Now, doctors will always talk about things like arthritis, and I want to talk to you for a second about that. Arthritis, the definition is arth, which means articular, which means joint, and itis means inflammation. So when a doctor says you have arthritis, he's telling you have joint inflammation. Come on, when you have any type of injury in a joint, you're going to have inflammation in that joint. He isn't telling you anything you don't already know, but he's calling it arthritis, so you think it's a disease when it's just a symptom from something being torn. There's also another type of injury, and that is when you tear your labrum. And what that means is it's the cushion between the ball and the socket. And there's like a cushion in your hip called the labrum. There's a cushion in your knee called the meniscus. And what happens is when you tear that, just like when you tear these, they never fix. When you cut yourself, you get this fibrous tissue, and that mends the tear. That doesn't happen in your joints. So we use dextrose, and dextrose is a sugar, and it's an irritant. And what we do is we put it right in where the tear is, and it irritates that tissue, and it lays down fibrous tissue to mend the tear like it would our body does when we mend our skin. And then if we have to go down a little bit deeper into the labrum, we flood the joint with the dextrose, and there's also B12 in it to help with the healing process. And that will make that soft tissue actually into hard tissue, so it's going to be a lot better. It's kind of like having hard tires on your car versus soft tires. A lot of people think scar tissue is bad. No, you need scar tissue to mend tears. It's just bad when they have to do surgeries and cut into you and make scar tissue in places that there shouldn't be scar tissue. But your body makes scar tissue to heal the different tears in your joints, on your skin, but not in your joints, okay? So the protocol is we do 10 treatments. You can either come once a week, twice a week. The most we can see you is 3 times a week. After we do that, you go home and you ice it. We also give you a brace, and the brace keeps your arm up into the joint, because that's why the surgeries don't work, because your joint is being compromised because your arm is hanging from your joint. And here we give you this brace that will keep it up. We don't stick you in a sling, because then you get frozen shoulder. And then I give you exercises, and I give you stretches that you'll do so you don't get frozen shoulder. And you'll do these while we do this. And you can't lift more than 2 or 3 pounds your first 6 months, 10 pounds your first year, and 20 pounds for 2 years, because the injury is so tough to heal, okay? And so you're gonna need to get some type of MRI. An X-ray is just not gonna show you the soft tissue. So if someone says they can see what's wrong with an X-ray, they can't, okay? So we need to get an MRI. We have a special here where if you need to get an MRI, it's only $250, and it's the best price in the country. We also, the first time you talk to me is a free consultation, so it doesn't cost anything to come talk to me. We could, like I say, get you an MRI and get you back in and go over the MRI, and you get to keep the MRI and the report. You'd be surprised how many doctors don't go over the reports with their patients or even give them the report. And then we actually even have a program where we lend you credit for 6, 12, or 24 months at 0% interest, because we really want to help you, and we know most people don't have the money to do something like this. And so you will have the whole program on my website. Go to allnaturalhealingsrq.com and look under conditions, and this talks about the shoulder. And then you can go to it's called Health Credit, and you can see the package and how much it costs there and what you get with the package. And if you have any questions, you can leave them in the comment section, or you can email me from the actual website, allnaturalhealingsrq.com. And if you have everything you need, go ahead and call the clinic at 941-953-3700. I really look forward to helping every one of you. And like I said, why don't you come in and talk to me for free and see your different alternatives to the injury you have. You'd be surprised how many people come to me, they don't have their MRIs, and then we get their MRIs and they didn't even know they had tears because the doctor just told them they had arthritis and they're going to have to get a joint replacement. So you really want to check out all your options before you make a decision like this, because this is a serious injury. I look forward to talking with every one of you, and I look forward to helping you heal your shoulder.